Every Monday, we like to find new ways to get healthy. Joining us today, Dr. Cody Martin from Portsmouth Medical Center. Okay, so we're talking joints, we're talking our knees, we're talking our hips, and the older we get, the more they start barking at us, the more we might be having issues. And especially, like, I know in my case, I played a lot of basketball, and my knees are not the best.
Okay.
So at what point do you talk to your doctor and say, might need a new one?
I think a couple things. So pain, obviously no one likes pain. So the more you're having pain, the more consistent the pain, and then your function. So when the pain starts affecting your function, which sometimes is sleep, sometimes, going to work, if you notice that you're being mean to your kids and your family more because your knees hurting all the time and grumpy.
Okay.
But definitely the pain and the function, I think, are the most important things. When you come to symptoms of arthritis, grinding, catching, clicking, locking, popping, pain, swelling.
We're not talking
motion.
dance moves.
Yeah, exactly. But so you just start noticing those symptoms.
Okay.
If you can tolerate it, then you probably don't have to get in a consult. But if you start noticing you're limping and not sleeping, and that pushes you to come see.
You can't do your 5-minute mile anymore.
Exactly.
So, okay.
Yeah.
So now that we've identified that we may have issues with our knees, issues with our hips, what do you talk to your patients about? Yeah, it's time to get a new knee or hip replacement.
The first thing is, typically getting an X-ray and actually looking the bony structures, and you're looking for the ends, at the ends of the joints, there's something called cartilage, it's the cushion, and when that gets thin and worn out, that's arthritis, and that's when we would know that a joint replacement is recommended or qualified.
Okay.
Once again, it balances your symptoms with having a bad joint. So just because you have a bad joint doesn't mean you have to have a joint replacement, but it's a discussion that we would have.
Okay.
And a lot of times it starts off slow that, oh, my knee hurts once a month, or, only when it's cold.
I'm going to tell it's going to rain in the next couple days.
Exactly.
My hip is acting up. So.
Exactly. And as it becomes more consistent, that should, prompt you to come and be seen.
Okay, so now we've been identified as needing a replacement of a knee or a hip. What's the recovery time for those different types of procedures?
It really depends on each joint. The hip replacement tends to be a little quicker than maybe a knee replacement. Either way, the first couple weeks you may wonder why you did it afterwards. A little rough, okay. But then you get physical therapy and get going by 6 weeks or so. Most people are doing pretty well. Now, when I say that, though, you are walking hopefully the same day or even the day after. We want people up.
Maybe a little assistance there.
You have a walker and you need some assistance, but by 3 months, you're about 70–80% healed, and it can take 1 year for that new kind of joint to be click in, where your mind and body are
working
all
together
whole. Yeah.
in that. Are there things that we can do to improve our recovery time? Obviously, following doctor's orders.
Sure. Yeah, we sometimes say prehab. So, if you're starting at a low point where the pain has gotten you to you're basically limping and bedridden, well, then that's going to be a harder recovery. So, actually staying moving as long as you can, keeping the weight down, and just being motivated to kind of push through the pain.
And maybe always moving.
Staying moving, yeah.
Okay.
You need to sleep too,
But yeah, I'll do my marathon while I'm sleeping. All right, Dr. Martin, thank you so much for coming in today.
Absolutely.
People like to get a hold of you. How can they do that? Yes, get you at Portsmouth?
Portsmouth Medical Center, 208-239-2620 is our number.
Well, fantastic. All right. Well,